Well, when I was in my 30s, I had the cutting done with the gums because the gums were not good. So the dentist at the time told me this would probably last 20, 25 years. And he was right on target there. A lot of pain, a lot of pain. Very, very sensitive. Couldn't eat anything, like the nuts were hard. And well, the longer it went on, the less I could eat. You couldn't tell, only I could tell. You know, I had all my teeth. In fact, when I got my teeth cleaned, I had to have them totally numb, my entire mouth. And that was for 20 years. When I first called Dr. Halusic, I knew nothing about implants, nothing about nothing. So they pretty much walked me through the whole thing. The procedure I had done on the first day was an all-on-4 on the bottom. He explained that I would need bone buildup. He said first we have to remove the old teeth, then we would have to build up the bone because he wasn't sure if there was enough there. And then he explained how the procedure would go and what actually he would do. So I decided to go ahead and do the top. And the top's a lot more involved because you're dealing with sinuses, and I wouldn't trust anybody but Dr. Halusic to do it. When you come in here, they just make you feel, you know, like family, and he never talks down to you. I think his goal is for his patients to be healthy and happy with his work. You know, he wants to make sure everything is still okay. Now I have no problems. I mean, it's just, it's phenomenal. There's no way to say it, it's just great. Now that I've had both top and bottom done, I can eat steaks, I can eat nuts again, which I couldn't eat before. I can eat apples, I can eat whatever I want to now. So it's like the difference is night and day. He gave me back my life. Now I might be getting older, but my teeth are still pretty.